The Ministry of Health officials in Uganda say there has been an increase in mental health illness among Ugandans. According to mental health experts, a range of social factors ranging from poverty and deprivation, gender violence, rape and social inequalities have led to the general decline in mental well-being of many Ugandans. However, the experts say alcohol and drug abuse are the major causes of mental illnesses among the cases admitted to different health facilities in the country.
Low education attainment, social inequalities and discrimination, poor governance, armed conflicts, poor health care, communicable and non-communicable diseases, among others. I'm going to give a little detail about these things. That's the jinx of the matter. What causes that? What brings about poor mental health?
It has to do with alcohol use. It has to do with drug abuse. You have seen truck drivers eating things while they are driving. And these are people who are causing accidents to our people.
Dr. Diana Atwini, the Permanent Secretary in the Ministry of Health, says the use of drugs and consumption of alcohol among youth is a particular cause for concern.
Go to Butabika. Actually, we should have conducted this meeting in Butabika so that you see the biggest percentage of young people, very young people who are coming with mental illness, it's like 90% is actually associated with drugs.
Dr. David Basangwa, the Executive Director of Butabika Hospital, says annually they admit between 9,000 to 10,000 inpatients. Of these, 20 to 30% are drug addicts.
The trend is increasing because about 3 years ago, we were on average admitting about 700 patients. It went 750. Currently, we are at about 850. So it's almost an increase of almost 100 inpatient per year, per day.
Dr. Twin has recommended a ban on alcohol circuits, which have been blamed for the rise in alcoholism because they are cheap and easily available.
And we want really to condemn, we want to condemn in the strongest terms, that those are not, they have nothing to do with developmental or they are paying taxes, the manufacturers. Those alcohol in circuits have contributed to the crimes, have contributed to the deaths of our people. Even the accidents you hear about on the road.
Despite the fact that there are increasing cases of mental illnesses among Ugandans, the number of specialized doctors to handle such cases is very low. The problem is made worse by the fact that medical students are becoming less likely to specialize in mental health issues.
Struggling to persuade young doctors to get into psychiatry, sometimes it's not easy. We are competing with many other areas. These days people like doing public health so much.
On a societal level, Ugandans still lack the necessary information to handle mental illnesses, and many still associate it with supernatural causes like witchcraft.
We have seen also some people who, instead of getting treatment, they opt to go for witchcraft. They think they are bewitched.
Juma Kiria, NTV.